Welcome to Practice Medical Cases with MedicoMedics. Before we dive in, if you want more high-yield, practical, clinical cases just like this one, please make sure to drop a comment below. This video is part of our new experimental high-yield practice medicine playlist. It is designed to sharpen your USMLE and clinical thinking in just minutes. And for every 10 comments to our video, we will post another question, and we will keep going until we hit 1,000 questions. So hit that like button, leave a comment, and join the journey, one case at a time. A 6-year-old boy presents with sore throat, low-grade fever, and difficulty swallowing. On physical examination, there is a grayish-white pseudomembrane covering the tonsils and pharynx. He is unvaccinated. A throat swab confirms the presence of Corynebacterium diphtheriae. A biopsy of the affected tissue reveals necrosis and loss of epithelial cells. Now, which of the following best describes the molecular mechanism by which the diphtheria toxin exerts its cytotoxic effects? Is it A, inhibition of RNA polymerase II, preventing messenger RNA synthesis? Is it inhibition of elongation factor II via ADP-ribosylation? Is it C, cleavage of host DNA by bacterial endonuclease? Is it disruption of actin polymerization by ADP-ribosylation of G-actin? Or is it formation of membrane pores leading to osmotic cell lysis? Please feel free to pause for a few seconds and see if you can figure out the answer. Now, if you selected B, then you are correct. The answer is inhibition of elongation factor II, or EF-2, via ADP ribosylation. Now, why is this correct? Because the diphtheria toxin is an AB exotoxin, produced correctly by Corynebacterium diphtheriae. Now, you can look at the pathophysiology illustration here on the left. So looking at step 1, we have the B subunit, or the binding subunit, binding to heparin-binding epidermal growth factor, or HBEGF, on the host cell. The toxin then undergoes clathrin-mediated endocytosis, so step 2 here. Then we have acidification of the endosome, which leads to conformational change and release of the A subunit into the cytosol. And the A subunit is the active subunit. Then the A subunit catalyzes the ADP ribosylation of elongation factor II. So we are at step 5 now. And it does this using NAD+ as a cofactor. Now, elongation factor II is essential for protein elongation during translation. So once it is inactivated, as seen here, once it's inactivated, protein synthesis halts, and this leads to cell death. So this toxin-mediated inhibition of elongation factor II is what causes local tissue necrosis and the characteristic gray pseudomembrane in the pharynx. Now you may wonder why it's not any of the other alternatives. So why is it not A, inhibition of RNA polymerase II? Well, this describes the mechanism of alpha-amanitin, which is a toxin found in the DTaP mushroom, or Amanita phalloides. And what it does, it binds RNA polymerase II and inhibits messenger RNA synthesis, leading to hepatotoxicity. So it's not related to diphtheria toxin. What about cleavage of host DNA by bacterial endonuclease? Well, this is not a mechanism used by the diphtheria toxin. The DNA cleavage by endonucleases may be seen in, for example, bacterial invasion mechanisms or certain toxins like E. coli, for example, but not here. And alternative D, so disruption of actin polymerization by ADP-ribosylation of G-actin. This describes the Clostridium botulinum C2 toxin and Clostridium difficile toxin AB, which targets actin via ADP ribosylation, disrupting the cytoskeleton. So the mechanism is sort of correct on this alternative, but it's the wrong target and wrong pathogen. And finally, the formation of membrane pores leading to osmotic cell lysis. Well, this mechanism is seen with streptolysin O from Streptococcus pyogenes. And these toxins form pores in membranes, causing cell lysis. So it's not the same mechanism used by the diphtheria toxin. And here you can pause the video and take a look at our high-yield review for Corynebacterium diphtheriae. So briefly, it's a gram-positive rod. ADP ribosylates EF-2, covers the pathophysiology, right? We just talked about up here. And this led to the inhibition of protein synthesis, leading to cell death. Transmission, respiratory droplets, or direct contact. Symptoms, sore throat, low-grade fever, gray pseudomembrane, pharynx. You can see cervical lymphadenopathy, myocarditis, neuropathy, airway obstruction can be possible symptoms. For diagnosing, we can do culture or Elek test or a PCR. Treatment, antitoxin ASAP. Otherwise, available penicillin or erythromycin. Airway support if needed. Isolation, of course. And prevention, DTaP vaccine. Or vaccine. And that's the end. Hope you found it interesting and insightful. And please remember, for every 10 comments to our video, we will post another question. We will keep going until we hit 1,000 questions on our playlist. Also, don't forget, for more easy-to-understand lectures, please visit our channel and check out our playlists. We post new videos every day. Until next time, keep it clinical.